Hi everyone, welcome to the Baptist Health Newsroom. I'm Georgie Pipkin. We had a little bit of a shift in topics today. We were planning on talking about swim safety, but as we see Hurricane Dorian approaching, we wanted to go ahead and get you prepared with our experts here today on everything you need to know. So we're shifting gears and we're going to talk today about hurricane preparedness, what to do before, after, and during the storm. As we always do with our Facebook Lives, if you have questions, go ahead and type them in. Make sure you kind of accurately put in any questions you might have. We'll answer as many as we can. We'll get to as many as we can throughout the show today. So with that, let me make some brief introductions. We have Dr. Joseph Scott here, who's our Chief Medical Officer over at West Kendall Baptist Hospital, and he rushed over here to join us today and give us all of his expertise and insight. So thank you for being here. And of course, Dr.
I do need to say it's the Director of the Emergency Department.
Emergency Department. Thank you for the correction.
You'll meet the Chief Medical Officer.
Good. And Dr. Fernando Mendoza, who's been with us many times from Baptist Children's Hospital, also in the emergency department. We're happy to have you both here today. We're so excited that we get to kind of tap into your insight and expertise. So with that, I'll throw it to both of you and kind of talk to us about preparations. People are, getting their water, getting cash out, getting gas. That's kind of the standard when we see South Florida kind of in the cone. Other than that, what else can people be doing with medications, other preparations? Give us some tips.
And I think you just said it. Medications are the key thing. Looking at your health needs and what are you going to need to get you through the storm. That's typically what we find is the problem, is that people are all worried about the water and the gas and not looking at how many medications do they have available. Where's their backup power supply going to be if they have something, an oxygen-dependent device or an electric-dependent device? So those are the issues that you need to start, have them on your list and start preparing now.
Okay, what about kids?
Yeah, for kids,
children.
Kind of piggyback off Dr. Scott, exactly that. The medications, especially in kids, when you're looking at certain medications that aren't going to be accessible if they need electricity. For example, many kids have asthma, or they wheeze or have bronchiolitis, and they're going to need maybe a nebulizer treatment, and that's plugged into the wall with a machine. Make sure you get the backup, the spacer with the puffer of albuterol, so you have the rescue medication in case there's an attack. Make sure you have a recent one. A lot of kids or moms will keep those in the glove compartment or in their purses or at home, and they may not be up to date. So now is the time, today and tomorrow, to get those refills done, because we don't know when the pharmacies are going to be open. Likewise, chronic conditions are the ones that you really want to worry about. So the asthmatics, the diabetic children, and again, like Dr. Scott said, anybody who's technologically dependent, in other words, a child who may be on a vent or have some of their needs from a feeding tube, make sure we have battery backup, you charge your batteries, you get those packs powered up so you have the device available to you throughout the storm.
Great. What about meals and nutrition? I think a lot of people are heading out to the grocery store and grabbing what they can. If there's any allergies in the family, what are some of the things that kind of should be on, top 10 things to buy at the grocery, aside from maybe batteries? What else can they?
People tend to like to go to the chips aisle and the sodas, okay,
Yeah,
the comfort foods.
Yeah,
but
what's healthier
If you're
option?
a diabetic, that's probably not the best thing, okay? You do need foods that can withstand lack of refrigeration. So your canned aisle is a very good thing, whether it's going to be beans or it's going to be the macaroni and cheese you can make for your child. Those things that you can use with water. My kids want me to go out and buy ramen right now. May not be the most nutritious, but these are the things you want to think about. But if you have somebody that's very dependent on a diet, whether it's diabetes, whether it's gluten allergies, those kind of issues, you need to find out that food now.
Great. And people, I think, forget about bananas and apples and some of those healthier options that really have a long shelf life, and you can just have them out for the kids or for whoever kind of needs a snack. So
they will definitely last through a storm.
Yeah.
There's no question about that.
Great. Let's talk a little bit about, just 2 years ago, Hurricane Irma was in our backyard. What are some of the lessons we learned? You guys are boots on the ground. You're seeing things come into the ED, both on the pediatric side and over at West Kendall. What are some things that you saw that maybe could have been prevented that we want to tell people now? Hey, make sure you kind of do this and that. This is what we saw. This is what we learned from the last go around. I'll kind of hand it to either one of you.
First.
Yeah. Well, I think one of the major things we saw were injuries, especially in kids. Parents or dads, and were enlisting the help of their kids to help take down shutters or clear brush. And most of the time, kids aren't really prepared to do that. The work may be pretty hard and pretty dangerous. Those metal shutters are pretty evil. And we saw lots of
tools lying around.
Tools lying around for sure. We saw some injuries with that. We saw a lot of lacerations, a lot of bumps and scrapes. some fractures, some kids falling from heights because they were out there, dad or the family's getting kind of everybody together or picking things up after the storm, and the kids are out playing. Remember, just because a storm is passed doesn't mean it's playtime. It's not time to go ride your bike. And we encourage outdoor activity, but be careful. You have down power lines, you have standing water. So we saw injuries with infections due to lacerations, and we definitely saw a lot more injuries right after the storm.
Okay.
So we also like to think of it kind of in 3 phases. So your pre, your during, and your after. And your after you could break into 2 phases as well. So pre, we kind of touched upon already the medications, making sure your oxygen supplies are up to date, and you have sufficient oxygen. Your oxygen supplier right now, if you work with an oxygen tank or something like that, you need to get extra oxygen tanks now. Talk to your oxygen supplier now. As was mentioned, get your medications because the pharmacies may close. All right. During, we don't see a whole lot. Where the people that usually have to worry about during are maybe the pregnant patients. Now, we have not called a disaster here right now. Hopefully this storm is going to go north of Dade County where we are. But if you are pregnant, especially in those last 4 weeks of your pregnancy, you want to talk to your obstetrician. After, as he mentioned, we tend to see 2 phases. One is early injuries from taking down those shutters, cleaning up debris, using a chainsaw for the first time in your life, those kind of issues that are a problem. And then the other thing that we forget about is that 4 or 5 days later, a lot of the mental health issues start to appear. So people that have been able to keep it together through the storm and right after the storm start to lose it. And quite honestly, you want to know about your family members, their mental health issues, and your neighbors as well, and anticipate that these things might happen because we saw a lot of those patients come in too. The other issue is while tetanus does occur, it doesn't happen immediately. Hopefully your vaccinations are up to date. But in the 24 hours we first saw after Irma, we had people lined up through our parking lot just wanting tetanus shots.
Wow.
Not the time to do it at that point in time.
Right. I should mention that we are offering Baptist Health Care on Demand. Dr. Scott touched on it a little bit. During the storm, please don't leave your house. You have a medical expert in your back pocket. Download the app, plug in. We're offering free visit for anybody in the next 2 weeks that needs medical care. Just plug in Dorian into the coupon code and it'll get you that medical expert during the storm. After you mentioned mental health, it's also applicable for any kind of psychological or mental health needs. You can use that and be at the comfort of your home and use Baptist Health Care on Demand. So Dr. Mendoza, you talked a little bit about standing water after the storm. Let's talk about it a little bit more. It is really dangerous, especially if the kids are out there playing. They don't have their electronics, maybe if there's no electricity. They're trying to find things to do. They're bored.
They want to get out there.
So what are some tips for parents?
Well, stay out of the standing water. I mean, really, we have flash floods. We have a lot of water that'll be standing after storms. Even after the past few weeks, we've seen a lot of these heavy rains that come into our streets, and you still don't want to play in the water. You don't know how deep it is. You certainly, as a driver, especially teenage drivers, you don't want to drive in any water where you don't see the, where you don't see the street. But we'll see, there could be down power lines, and certainly, it may seem like a lot of fun to splash around. Whether it's hidden debris, glass, sharp objects, existing cuts and bruises getting into standing water could really lend itself to really serious infections. And something else I want to mention that Dr. Scott talked about in the immediate post-after, a lot of people have generators. Those generators need to be run in open air, not in a garage, not next to the house. We do see a spike in carbon monoxide poisonings in the ER. It's one of the most dangerous injuries after a hurricane because you don't feel it, you don't see it, you don't even smell it. So what happens is people, there's still some rain sometime after a storm, or they want to put the generator close to their house that maybe don't want to get stolen or damaged, and it's right next to an open window exhaust, carbon monoxide comes in, you're sleeping, and you won't smell it, and that would be really, really dangerous, fatal even. So generator operation outside, away from the house, away from your neighbor's windows, away from any kind of area where you can that those exhausts can get into the house or even in a contained space like a garage. Very careful with that.
Great advice. I think here in South Florida, we like to have fun after the hurricane. People aren't working. If the damage isn't too bad, we always see these videos of people just out there with boogie boards and all sorts of things. So kind of to elaborate a little more on the water, because I think it's so important. People think it's all fun and games, but what about the bacteria that's in these waters? That's also not.
There's tons of bacteria. They go through a laundry list of what's in the water. I mean, in any standing water, and actually, not to mention boogie boards also diverge to the beach. A lot of young kids will get out and kind of be adventurous. Hey, let's go surfing. The surf's up. It'll be up in the next couple of days. We know that. Surfers know that. super dangerous. You know where your kids are. Make sure you're really discouraging getting out there into the open surf. Those riptides will kick in, and people drown every year in anticipation of hurricanes because they're trying to get out there and surf. So that, that's in the open ocean. And anytime you have standing water, whether you have fecal material, which is basically E. coli laden material, stuff that where dogs or cats may have stool or bowel movements in, you're going to have really high risk of infection. So stay away from standing water for sure after a hurricane. And then even a little bit after that, make sure the standing water, that when the storm has passed, clear all that water. We want to avoid that second or third phase of mosquitoes kind of really proliferating. Right. And we have some mosquito-borne illnesses that they're becoming a little more prevalent now in Dade County. So get rid of that standing water for mosquito kind of population reasons.
Great advice. Great advice. Stick with us. We're going to keep talking about this. We have Dr. Berrios joining us in just a bit. As I mentioned, Baptist Healthcare on Demand. Just go ahead and download the app just to have it in your back pocket now. Keep asking your questions, and we will be right back with more. Thank you. Everybody, we are back with more information on hurricane preparedness planning. This is not meant to be hysteria. People tend to get a little bit crazy in South Florida with the traffic. We really just want to have our experts here today to provide you with the best information. So stick with us. We are joined now by Dr. Zulma Berrios, Chief Medical Officer at West Kendall Baptist Hospital, and Dr. Joseph Scott is sticking with us, our Chief of Emergency Medicine at West Kendall Baptist Hospital. Thank you both again for being here. Dr. Berrios, I want to start with you, and Dr. Scott alluded to it a little bit. Pregnant women, talk to us a little bit about what they should be doing in preparation. I think it's maybe 35 weeks, 36 weeks, they should maybe start talking to their physician about possibly making a trip to the hospital before the storm, but kind of elaborate on what that protocol looks like and what they should be preparing for.
So for all the hospitals at Baptist Health, we have protocols that indicate that we advise our patients, the pregnant patients, to have a conversation with their obstetrician, especially if they are over 36 weeks of pregnancy,
okay,
or if their physician has indicated that they are at high risk pregnancy. Okay. So those are the patients that we will offer sheltering them 24 hours ahead of an event that will require them to be very close to the hospital or at the hospital. So it's, again, over 36 weeks, and patients that have been deemed high-risk pregnancies, even if they're not 36 weeks. They should be having that conversation with their obstetrician and considering to come over to one of our hospitals that offer obstetrical services.
Okay, great. Yeah, the last thing you want is trying to travel during the storm and get to, because I think people don't realize that often first responders can't necessarily get to you once that storm has started. So
correct.
You kind of want to get to where you're supposed to be ahead of time. So
yeah, correct. Miami-Dade Fire Rescue and other emergency transporters will not provide operations once they start. We experience tropical storm force winds. So right. Then the transportation is going to be very precarious at that moment. So if the patient is in those situations, then perhaps the best place to be would be at the hospital. There's some restrictions because a hospital is a limited space. So, the patient will come only with one adult that can be with them. Unfortunately, will not be able to provide care for other minors that may come right. with that expectant mother, and they'll need to be able to provide for their own food and the mattress that they're going to use to maintain the comfort of themselves during the time during the event until they can go back home after the all clear is received from the county.
Great point. And I think we should also mention that the hospitals are not shelters. They're really meant for emergencies, for folks that really need medical care, potentially, pregnant women after 36 weeks. So I don't know if Dr. Scott, you want to elaborate on that, but just make it clear that EDs and emergency departments are not shelters.
So true. I mean, not just our facilities, but all the hospitals in Dade County and across South Florida are typically full most of the time. So we typically will have patients there that need to be there, but we highly encourage people to shelter in place, shelter with their families. If you need a special needs shelter because you have one of those devices that needs to be plugged in, electricity, those kind of issues, there are special needs shelters out there. We would hope you've already made those arrangements, but those numbers are still available on the emergency management websites for each county in our area. But the hospital is not the place to be unless it's an absolute emergency.
Talk to us too a little bit about medical supplies that you can kind of have in that first aid kit at home. Obviously Band-Aids, the basics. Anything else that people maybe should prepare, go grab, at their local pharmacy?
Splints,
Okay.
Medication for pain, Tylenol, ibuprofen,
Okay.
So acetaminophen, ibuprofen. Allergies, we typically see rashes, itching, people don't know what it is. A little bit of Benadryl is probably helpful as well. It'll at least hold you over in that situation. So those are the medications, as Dr. Mendoza previously mentioned. If you have asthma, those chronic diseases, you need to have those medications there as well. And a good first aid cream, and then soap and water.
What about folks who maybe have larger equipment, a wheelchair, some equipment that requires a little bit more, maybe not even electricity, but things that are just larger to get around? Any advice on what to do with that kind of equipment, or status quo for most people?
If it's going to be around your house, it's going to be status quo. If you're going to a special needs shelter, then you want to limit the amount of equipment that you bring there. But if you need a wheelchair to get around, then you're going to need that wheelchair. If this is an electric wheelchair, you need to have the alternate power. And if your electric, and what I would also recommend is that most people with electric wheelchairs have a manual wheelchair available. That should be in working order.
Great.
Okay? Because the battery may run out.
Good advice. Talk to us a little bit about, I see on your lab coat here, FIU. I know we do have a partnership with FIU. They do help us out during hurricanes across Baptist Health. Talk to us a little bit about that partnership and what they help us accomplish.
They have a pretty well-developed disaster response team that actually works with the state as well as in our local area. And so, for example, in Hurricane Irma a couple of years ago, just to give you an example, we typically see at West Kendall maybe 160, 170 patients a day in our emergency department. On the day after Hurricane Irma, we saw 330, wow. Which is a huge amount for an emergency department our size. They brought in their team with extra personnel, and we worked 24/7 to get through the masses of people that we saw that entire week after the hurricane. So it's a great partnership that we have, and the physicians and the nurses and the techs all from FIU are available out there as a disaster team.
Great. Dr. Berrios, I want to bring you in here, and if you could summarize, I know it's a lot of information, but many in our community speak Spanish, and I want to give you the opportunity to talk a little bit about some tips for prevention, much of what we discussed here today, but in Spanish, so that many can either ask those appropriate questions or really get that information firsthand from you, that since we have you here and we're lucky to have her. So with that, Dr. Berrios, por favor, habla un poquitico que hablamos hoy para la gente que están escuchando en español.
Sí, para la gente que nos está viendo en Facebook Live, en Facebook en vivo, que hablan español, que son hispanoparlantes, voy a resumir la información que hemos compartido hasta ahora. Primero, es momento de estar preparándose. Aquellas personas que tienen enfermedades crónicas como diabetes, asma, necesitan medicamentos para mantener esas enfermedades bajo control. Este es el momento de asegurarse que, aparte de comprar comida, buscar gasolina, tener dinero efectivo en su cartera, van a tener ese medicamento accesible en la preparación. Durante el evento atmosférico, pues le pedimos a las personas que se mantengan en sus casas para evitar entonces accidentes innecesarios. Después del evento, vemos las cosas más comunes que vemos en las primeras horas son personas que se accidentan cuando salen a remover escombros, a cortar los árboles que están caídos. Entonces esas son el tipo de cosas que son prevenibles, que queremos entonces llamar a la ciudadanía para que no se expongan a ese tipo de riesgo. Porque son entonces las cosas que más comúnmente vemos en las salas de emergencia las primeras 24 horas. Luego de esas 24 horas empiezan entonces más los problemas emocionales, las personas que han mantenido la calma relativa después del evento, pero entonces empiezan a tener ansiedad y ese tipo de otras manifestaciones mentales. Eso es lo próximo que vemos. Para eso entonces, como mencionaste antes, tenemos la aplicación de Care on Demand con el código Dorian, que va a estar accesible para la comunidad durante las próximas 2 semanas para que en lugar de presentarse a la sala de emergencia puedan entonces accesar a servicios médicos de esta forma durante una aplicación que es muy accesible.
Tan importante,
y muy
tener
importante,
a alguien que te pueda ayudar.
Correcto, vas a tener un profesional de la salud cualificado que te va a poder ayudar durante este momento. Nuestros hospitales están capacitados para ayudar a todas las personas que necesiten emergencia, pero no son refugios. Y entonces, porque queremos dar la oportunidad de dar buen servicio a las personas que tienen emergencia, le recomendamos a la comunidad que utilice esas otras formas de accesar servicios médicos. Nosotros tenemos centros de Urgent Care y tenemos un freestanding ED. Estos se mantienen cerrados tan pronto se empiezan a sentir vientos de fuerza de tormenta tropical. Entonces le pedimos a las personas que se queden en casa, pero después que recibimos el visto bueno del county, esas operaciones vuelven a resumir. Para nuestras personas embarazadas, las embarazadas que tienen más de 36 semanas o que su médico les ha dicho que tienen un embarazo de alto riesgo, deberían tener primero comunicación con su médico obstetra de cabecera, pero en Baptist Health, en los hospitales que proveemos servicios obstétricos, nosotros proveemos oportunidad para esas mamás que vengan al hospital durante el evento. Como tenemos espacio limitado, estas pacientes solamente pueden venir con un adulto. Desafortunadamente no podemos proveer cuidado para niños menores que pudieran estar acompañando a estas mamás que están embarazadas, pero estamos dispuestos para que ellas vengan. El teléfono a llamar es 1-866-639-5431, 1-866-NEW-KID, the number 1. Ese es el número que tenemos para información para nuestras madres embarazadas.
Perfecto, perfecto. Muchísimas gracias por toda esa información. So we'll switch gears quickly back to English and make sure that we answer some of our community's questions. So feel free to type in anything you have. We've covered a lot here today. We want to make sure that everybody has what they need. It's not meant to be, like I mentioned, hysteria and everybody go nuts, but prepared. You know, have the materials or the supplies or the medical equipment that you need. Make sure you download Care on Demand. Have that app in your back pocket, on your phone, in your tablet, just in case. You can use the code DORIAN, the name of the storm. Plug that into the code and you can use it for urgent care visit during the storm. You can use it for any kind of mental health expert advice that you might need. It's a great tool to just have in your back pocket. So with that, we'll take a few questions. I know we answered a lot, but I know our community has been chiming in with some questions. So here's one for our mental health kind of topic, panic attacks during the storm. People are asking about during, but I think even before, people are already having panic attacks and, you know, getting in line for whatever it is that they need. How can we kind of keep people at ease and the stress level low? A lot of folks are prepping not only their homes, their families, but their work life. So how do we balance it all?
I think it's important to understand, first of all, what do you normally do for your panic attacks? How do you calm yourself down? Those resources are still there. They're not, you know, if it's people that you use that you call them, okay? If it's medication you use, you have those medications with you. If it's the deep breathing exercises, whatever those are. And understand that we're kind of all in this together. And the other thing is that we in South Florida are incredibly prepared. We've been through tons of storms like this, okay? And we always come out the other side, and we usually come out better. So it's important to remember that you will get through this, okay? The last resort, obviously, is the emergency department if you have to. But normally, I would encourage you, do not change your habits. As much as possible, keep the same routines. Just prepare for a couple of days extra.
Perfect. Great advice. Any, we already addressed this a little bit, but one of our viewers is asking, with a woman who's 38 weeks pregnant, what can she do? So I know, Dr. Berrios, you touched on it a little bit, but start making your preparations to potentially, if over 36 weeks, in this case it's 38 weeks, to see where your closest hospital would be or where you would potentially be delivering, and at what point do they go ahead and check in? Is it 24 hours before, 6 hours before? What is that? Or follow the protocol from your physician?
First, you should be preparing like if any other person in South Florida would be preparing, making sure that you have your family, you're setting your family, that everything is set in the event that you'll need to be sheltered at the hospital. For sheltering at the hospital, pregnant patients over 36 weeks or young or high-risk pregnancies less than 36 weeks, and a conversation with their obstetrician. And it's then a personal decision. If you want to shelter with us, you can shelter with us. It will start 24 hours before we expect the tropical storm force winds to arrive to the local area. If you have any questions, we have a hotline, and I'll repeat it again. It's 1-866-NEW-KID, the number 1-866-639-5431. And you should shelter at the hospital where your obstetrician practices.
Perfect.
Mainly we have obstetrical services at South Miami, Baptist Hospital, Maine, West Kendall Baptist Hospital, and Homestead Hospital in the South Florida area. We have to remember also that we have now Boca and Bethesda West and Bethesda East, the same, they will have their own emergency phone lines, but they will probably follow the same offerings to protect their patients. Direct conversation with the obstetrician, and if there's shelters availability at the hospital, it's at the hospital where your obstetrician is practicing.
Perfect. Great advice.
One other quick item which applies to everybody here is that you're going to be stressed, you're going to be running around, it's going to be hot, you may not have power. Stay hydrated.
Stay hydrated.
And staying hydrated will decrease your panic attacks, make you feel better, and maybe decrease some of those contractions you're feeling as well.
Great.
So
great advice.
Stay hydrated.
I think that's for, like you said,
Yes,
not
for
just for the
everybody.
pregnant women, but for everybody, because you see
Patients
people
too.
stocking up on the alcohol.
Yeah.
But make sure that you're drinking water too. Make sure you grab a couple of cases of water as well. So
Exactly.
thank you both for being here. We really appreciate it. This is really great advice. I think what I've learned here today, stay calm, stay hydrated, and if you do need medical care, there are options depending on the level of care that you need. But Baptist Health is here to serve you in anything that you need. As we mentioned throughout the segments today, Care on Demand is a great tool. Make sure you have that in your back pocket. We thank you both for being here, Dr. Scott and Dr. Berrios, and of course Dr. Mendoza, who was with us earlier. We will catch you next time on Baptist Health Facebook Live. Thank you and have a great day. Be prepared.